Hi, everybody.
Hi.
Welcome to another exciting edition of Living at Your Highest Quality of Life with the doctors at Inspire Wellness. I'm Dan Neides with.
Jessica Hutchins.
So, welcome. We really appreciate you being here and appreciate your suggestions as far as these topics. So, please email us, message us on Facebook, as we would like to be able to make sure that we are serving you, the patients, on the topics that you find so important to elevating your quality of life.
Yep. So today we're going to talk about psoriasis and psoriatic arthritis, one of the main complications that comes along with psoriasis. And hopefully everybody knows that it is an autoimmune disease. So we come at it from a functional medicine approach like a lot of autoimmune diseases. If any of you actually have psoriasis yourself, you might be familiar with maybe in the summertime, you can't go to a pool, you can't take your shirt off, you have to wear long pants because you're scared of all the big red, thick, itchy plaques that are all over, or you're embarrassed when to put your hair up because of the plaques on your head. So there's a lot of embarrassment that goes along with that. And then if you're suffering from the arthritis part of it, you may find that you can't climb up the steps as easily, or you used to work out all the time and be really fit, and now it hurts too much to work out because of all the joint pain you have. So, there's a lot of issues with quality of life in something like psoriasis as well.
Absolutely.
So I was hoping you could give us an example of what it's like to go through kind of functional medicine treatment for this kind of thing.
Well, I think one of the other issues that people deal with also is side effects of not only sort of the biologics that come with the treatment, but oftentimes the topical steroids or even the oral prednisone that patients often have to take to manage both the pain and the skin condition. So, definitely want to recognize the side effects from these medications that are also potentially problematic for a lot of these people.
Right, and sometimes the medications do help short term, but they're never without side effects.
Right.
For sure.
So you had asked about a case. So I had a case recently within the last several months, of a 48-year-old female who had been previously diagnosed with psoriasis and then psoriatic arthritis. And this is a typical pattern of the way that patients will oftentimes present. So she had been dealing with the skin condition for many years, maybe even up to a decade. And then within the last several years, the arthritis started to develop and then increase and was really impacting quality of life. And so she had been working with a rheumatologist, had been prescribed prednisone, multiple rounds of steroids over the course of years, and then eventually got to a point where it was decided that biologics would need to be introduced in order to reduce symptoms. And so when we're talking about biologics, the medications like methotrexate, Humira, Remicade, we often see these commercials on during the evening news. So many of you, whether you're dealing with psoriasis, psoriatic arthritis or not, have seen the commercials for these medications. And so this particular patient had been on methotrexate for a period of like 6 to 8 months, wasn't really tolerating it because of the side effects, and eventually things escalated to doing infusions with Humira. And I think what really drove her in was looking to see if there were alternatives, because like so many patients who are dealing with autoimmune conditions, they recognize that potentially they're all robbing Peter to pay Paul, because if you're treating an autoimmune condition with an immune suppressor, then how does your immune system react to organisms that could be a threat, or cancer cells that are starting to develop into a malignancy? I mean, we need our innate immune system to be able to fight on our behalf, protect us from those threats. And again, I think for people who either look at package inserts, or maybe they read the information that comes with an advertisement, or they really pay attention to what the side effects are during the commercial, this particular patient was most concerned about the risk of cancer. I think they specifically say something about lymphoma. So with all of that swimming in her head and trying to figure out like what would be her next best move, she decided to at least explore a functional medicine workup to see if we would be able to identify opportunities for treatment that wouldn't require a biologic. So after taking a really detailed history and performing an exam, we together, outlined a deeper dive in terms of what would be the best way to identify root cause. So for this particular patient, because she had been on prednisone so frequently over the previous decade, I was particularly concerned about an overgrowth of yeast or candida. We've talked about that before. So would she have what we call dysbiosis in her gut, which would be sort of these atypical or opportunistic organisms, I should say, that disrupt the microbiome. So I was particularly concerned about that. And then wanting to figure out a little bit deeper, were there potentially food triggers or sensitivities that could be increasing her immune response? So, after sitting down and really cultivating a plan to try to figure out exactly what might be, her triggers, we did a food sensitivity test. And we also looked at her gut by doing a stool analysis called really a microbiome test known as GI-FX. And I did some kind of traditional lab work looking at her kidney and liver function, looking for evidence of inflammation. Those markers are things like C-reactive protein, insulin. I wanted to look at detoxification because detoxification so frequently is a challenge for patients who are dealing with autoimmunity. So testing MTHFR.
I was going to ask about that.
So testing MTHFR, right? And we've talked about MTHFR. So if that is new to anybody watching, we do have a video that you can find on our Facebook page explaining what MTHFR is. But basically, it is a window into a patient's ability or lack thereof to be able to detoxify. Did candida antibodies, in addition to looking at thyroid and a homocysteine level. So we kind of put all of this together, and ultimately what we found was that this person had significant food sensitivities. And the food sensitivities, when we get the result, can be graded from 0, which would be a non-responder in that category, all the way up to level 6, which would be the most significant response. And so what we found in her was that she was a category 6 for all of the dairy or cow's milk section. She was a level 5 for egg white and egg yolk. And she had multiple level 4s and 5s in many of the gluten categories. So that would be like the gliadin antibody, gluten antibody, spelt, rye, and then wheat itself. So these were all category 4, 5, and 6s. And so, we could then identify, these might be things that are kind of poking at your immune system, leading to some of the antibody production. She also had some lower level antibody responses to things like soy and green bean, lobster, and tomato.
So was she born with all those food sensitivities?
Well, so she wasn't born with all of those food sensitivities, but they develop as a result of having something called intestinal permeability, or as we've talked about before, leaky gut. So as inflammation is increased in the area where we absorb or should be absorbing, it can lead to some issues with malabsorption and food particles literally leaking right into the bloodstream, which would create a possible antibody response. So more than likely in this individual, over time, over years, she was developing these antibody responses to these foods. And I want to just qualify by saying that this is not food allergies. These are sensitivities. So the antibody that we're testing is IgG, G as in George. IgE as in echo is the antibody for true allergy, which can lead to anaphylaxis, which is trouble breathing, lip swelling, tongue swelling, etc. So this is IgG testing. So it's more on the sensitivity side, but definitely contributing to inflammation and to leakiness. When we analyzed her microbiome, not only did we find that she had problems with pancreatic activity, so she wasn't producing enough pancreatic enzymes, she had a high level of fat in her stool, which would indicate that she wasn't secreting enough bile from her liver or gallbladder, as the holding bag, if you will. But she had evidence of candida. She had other opportunistic bacteria, organisms that can lead to this overgrowth. And if we have organisms that shouldn't be in the microbiome, well, they're basically doing at least two things to be disruptors. One is they're crowding out the good guys, but they're also stealing nutrition from the good bacteria and from the microbiome. And remember, your microbiome is so critical to your survival, to our survival. So you want to be able to highlight the good bacteria, and you really need to remove any of these opportunistic players so that your microbiome thrives, and then ultimately your microbiome is directing so much of the traffic as it relates to your immune system. So this does become a little bit of a complicated story that we all have to, kind of tie together. So, basically what we decided to do was, tackle her issues through the lens of chronic disease. So what are the things that we talk about week in and week out? What drives chronic disease? And for those of you at home who are raising their hands saying, I know what this is, doc, I know what this is, right? It's inflammation, deficiencies of vitamins and minerals, and an inability to detoxify out those things that the body doesn't need or want to hold on to. So when we look at it through that lens, and that's really for my own purposes to make sure that I'm doing right by everybody, that's really the approach that I take, whether it's dealing with psoriatic arthritis or any other chronic problem. So for this particular person, what we wanted to do is figure out, okay, where's the inflammation coming from? We can certainly identify foods, and we talked about those that were triggers for her. So we removed those foods that were 4, 5s, and 6s, so basically all cow's milk, eggs, and gluten. We significantly reduced the level of those foods that were categories 1s and 2s to no more than once or twice a week, and knew that we would be able to significantly impact some of her inflammation. In addition to doing that, we decided to treat the candida and these opportunistic organisms. So basically kind of cleaning up the gut, getting rid of the bad guys, enhancing the good guys. And the important part of the story is, so what ultimately happened in follow-up. So once I saw her back at her 8-week follow-up appointment, not only was she starting to see resolution and the patches on her skin, but the arthritis was significantly improved. She was starting to exercise. She was doing mindfulness work, had signed up for a yoga class, hadn't started that yet, but she had downloaded an app on her phone, it was either Calm or Headspace, and was doing meditation. So she was trying to get her stress under control. So, she was doing the heavy lifting as it related to, reducing inflammation. And then we did add some supplements. So I put her on fish oil, I put her on turmeric and vitamin C, a good multivitamin, as a way to try to reduce inflammation, not just from dietary sources. And then looking at the deficiencies, she had vitamin D deficiency, she had a low level of magnesium, and I believe she had low zinc. So we replaced the things that were low. But the thing that I really want to highlight, and I think really impacted her the most, was on the detoxification side. So thankfully, she lived close enough that she came in and started using the infrared sauna here a couple times a week. And I think that's really what started to push her closer to her goal, because I think most of the patients that I see have a pretty good handle on inflammation and deficiencies. It's the detox side that really represents so many of the challenges moving forward. So after only a couple months, she was already starting to move the needle in the right direction. And folks, this was on no biologics. She wasn't on methotrexate. She had not started the Humira. And so her goal was to try and get her symptoms under control and be as close to symptom-free as possible through a functional medicine approach. And that's exactly where we were at, as of a few weeks ago. So really happy. And I mean, this is the story that we hear over and over again, and patients who are willing to do the hard work, who are willing to, to investigate, scratch below the surface and identify where's the inflammation coming from, what deficiencies do you have, and then do the heavy lifting as it relates to detoxification.
Great.
Wow, that was one breath.
Yeah, it's a lot of good information. Thank you.
Sure.
So I guess just to reiterate, we come at it from a functional medicine point of view, where we need to identify each one of your individual triggers and sources of inflammation, poor nutrition and inability to detoxify. So you hear us say the same thing over and over again, because it really is, I think, the best way to approach most chronic diseases is to figure out for individuals what triggers there are. And I will say a note about, although we do individualize most of our plans, as far as autoimmune disease, especially arthritis, fish oil and turmeric or curcumin are probably hands down the best anti-inflammatory supplements out there. So it's always a good idea to be on those as well.
Right, but I think one of the areas as this starts to take off in the state that's going to impact the chronic disease paradigm is honestly CBD oil and medical cannabis, because so many of the patients that have severe chronic pain as it relates to autoimmune arthritis, they've already started to use cannabis in their armamentarium. As you know, the program in Ohio hasn't officially started in terms of the dispensaries being open, but many of the dispensaries in Michigan are offering patients an opportunity to take their prescriptions there and get started. And I've been really impressed with the feedback that I'm getting, not only from the ease for these patients who are going there and traveling a great distance to get their medication, but what they're telling me on the back end after they're using it is, wow, what a great anti-inflammatory that it's been for them. It's eased their pain. It's reduced their stress. I mean, however they're using it in terms of their chronic pain, their autoimmunity, it seems to really be impacting them. And so as this program in Ohio starts to get rolled out towards the end of this year and into the beginning of 2019, I'm really anxious to see the impact that the anti-inflammatory components of both CBD and cannabis, how that's going to impact those patients who maybe augment with a biologic or are simply going to replace their biologics with other anti-inflammatories. So I just want to throw that out there because it is part of our toolbox, it's a tool in our toolbox now.
Great.
So I know we're up against it, and we went a little bit over.
Yeah, well, great. So we want to remind you again about the farmers markets. There's probably not too many weeks in the summer left to get out there without being freezing. So we need to do that too this weekend.
Outstanding.
Do it. And please send us your ideas for new topics next week, and we'll be back next Tuesday for you.
Absolutely. And it's your opportunity. It's your opportunity. It's your time to thrive. Let us inspire you. I'll learn that tagline one week or another. You guys have a great rest of the week. Take care. Thank you again.